Hello, my name is Dr. Lisa Nesson. I'm with Iron Gate Equine Clinic, and today I'd like to show you how to apply a full leg bandage to the hind leg of a horse. This might be used if your horse has an upper limb or hock injury that needs to be bandaged, or if they have a soft tissue infection that has resulted in swelling from the ground to above their hock. The reason we apply a full leg bandage when we're applying a bandage to the upper leg is to give the bandage support so it doesn't slide down the leg. So you have to apply a lower leg bandage in order to keep the upper portion of the bandage in place. So you want to apply the lower portion first. And there should be adequate padding so that you don't apply too much pressure to the tendons or cannon bone. And I like to apply brown gauze, especially if we're using this on an injured leg. Brown gauze to hold this layer in place and also to incorporate it into the upper portion. If you go down low enough to incorporate the fetlock, that will help prevent it from sliding. So you want this snug but not overly tight. And the gauze should lie smoothly against the bandage without any wrinkles. So a good test is you should be able to get a finger in your bandage without too much trouble, but not several fingers. So that's the lower portion. So then the upper portion, we'll overlap it slightly with the lower bandage and go over the hock. Of course, this one's going to be a little more difficult to get in there flat just because of the anatomy of the horse with that point of the hock out back. But again, lie it as smoothly as you can. You can also use a wider bandage if you want to get up higher. And again, apply brown gauze to hold it in place. Now, there's two different ways you can address the point of the hock and not putting too much pressure on it. One way would be to figure eight your bandage around it like this and leave the point without any direct pressure on it. And that will help hold it in place. The biggest thing about a hock bandage is that you don't want too much pressure on this large tendon that goes to the point of their hock. And you need to have adequate padding there so that they don't get a pressure sore. And then go ahead and wrap this to the bottom and then down onto the bandage on the bottom as well, because that helps tie the two bandages together. And then after I have that in place, I usually start at the bottom, especially if the leg is swollen, because it'll help push fluid back up the leg. And the vet wrap you want to have on at about half its stretchiness and overlap it. It's going to take probably 2 rolls on this leg. And then just keep wrapping up the leg, overlapping about 50%. So the other way that you can address pressure on the hock is to, at the end, we'll make a cut at the point of that hock to relieve that pressure. Because aside from these tendons, we don't want to have pressure directly on the point of their hock because that can create a sore as well. So you want to come to the top of your bandage, but not beyond it. And then you can just roll out the rest going back down or figure eight your hock again to help hold it in place. And then I usually, especially if this is for a wound, I usually put some elastic on at the top to help hold it from sliding, as well as to keep dirt out of it. And this should just lay on the skin. It shouldn't be pulled tight. And then you can put another wrap on the bottom as well. And then you want to just make a small cut at the point of their hock to relieve that pressure. Okay, now one thing to keep in mind when a horse has a full leg bandage on behind is that they will usually take an abnormally large step the first time they walk on it. So just be ready for that. Get your things out of the way. It just feels odd to them. So that's normal. They usually take a couple of awkward steps before they get used to it. Or more than a couple. And start walking more normally. Thank you.